as FEMA policy continues to evolve and changes are posted. Again, this presentation is specific to the coronavirus pandemic safe opening and operation work eligible for public assistance, the interim policy, DR 4480NY. On April 5th, FEMA released the Safe Opening and Operations Work Policy eligible for public assistance. This policy reflects President Biden's memorandum to extend federal support to governors' use of National Guard to respond to COVID-19 and to increase reimbursement and other assistance provided to the state. That was issued on April 5th of 2021. The presidential memo authorized FEMA to provide funding to public assistance applicants for the safe opening and operation of eligible facilities at 100% federal cost share, starting January 21 of 2021 through September 30th of 2021 for eligible work. This policy applies to disaster declarations issued by the President for the COVID-19 pandemic. As stated earlier, this policy governs work performed on or after its effective date of January 21st, 2021 through September 30th, 2021 at 100% federal cost share. This policy and others specific to COVID-19 can be found on DISH's website. For work completed prior to January 21 of 2021, FEMA's prior interpretation of the policy still applies, regardless of whether the project is submitted before or after January 21 of 2021. Work that is otherwise eligible under the September 20th interim policy labeled Coronavirus Pandemic Work Eligible for Public Assistance Interim remains eligible for assistance. Again, please refer to the DISH's website for specifics on that policy. Now, this slide provides a table format showing the types of work and costs that are eligible for reimbursement through public assistance during each of these three eligible periods for this disaster. You will note that given the length of the pandemic disaster, we have currently three distinct periods. We strongly recommend that for project containing work performed over the various time periods, identify the costs associated with each time period and document separately. At this time, we have the above three time periods: January 20th, 2020 through September 14th, 2020, September 15th, 2020 through January 20th, 2021, January 21, 2021 through September 30th, 2021. Now we will get into eligibility considerations related to this policy. In order for work related to the safe opening and operation in COVID-19, the item of work must be the legal responsibility of the eligible applicant. All work must be required as a direct result of the pandemic. The applicant must abide by the equitable response and recovery requirements outlined in this policy. This only applies to work performed from January 21st, 2021 through September 30th of 2021. The applicant must also demonstrate that it has the legal responsibility to perform the work. Generally, protecting public health and safety is deemed the legal responsibility of the state, local, tribal, and territorial government entities. To determine legal responsibility for emergency work, FEMA evaluates whether the applicant requesting the assistance either had jurisdiction over the area or the legal authority to conduct the work related to the request at the time of the incident. The legal responsible government can enter into a formal agreement or contracts when it is necessary to carry out eligible emergency protective measures in response to the pandemic. FEMA has currently waived the primary use and primary ownership normally applicable to PNPs that own or operate mixed facilities. Allowability of costs. As stated in previous COVID-specific policy presentations and prior applicant briefings, the cost must be necessary and reasonable to respond to the COVID pandemic. They must conform to the standard PA program eligibility and other federal requirements. In addition, the applicant must follow its own established policies and procedures that apply when federal funding is not available. Cost is documented with sufficient detail for FEMA to evaluate compliance with federal laws, rules, and other public assistance program requirements. Now to cover equity pandemic response and recovery. As stated in Executive Order on Ensuring an Equitable Pandemic Response and Recovery dated January 21, 2021, COVID-19 has disproportionately impacted communities of color and other underserved populations, including members of the LGBTQI+ community, persons with disabilities, those with limited English proficiency, and those living at the margins of our economy. As a condition of receiving public assistance funding, recipients and subrecipients must focus the use of FEMA funding on the highest risk communities and underserved populations. Recipients and subrecipients must prioritize resources to ensure an equitable pandemic response. Failure to adhere to this policy could result in funding reductions and/or delays. FEMA will monitor this compliance. It is understood that no person on the grounds of race, color, or national origin be excluded from participation in, be denied the benefits of, or be otherwise subjected to discrimination under any program or activity receiving financial assistance from FEMA. The distribution of disaster relief must be accomplished in an equitable and impartial manner. Now we get to work eligibility per this policy. The Safe Opening and Operation policy allows for eligible public assistance applicants to be reimbursed for certain costs associated with the opening and operations that were restricted by the 2020 interim policy. These measures include the purchase and distribution of cloth face coverings and PPE, cleaning and disinfection, COVID-19 testing, screening and temperature scanning, acquisition and installation of portable temporary physical barriers, and purchase and storage of PPE and other supplies based on projected needs. Now we will cover coordination of funding. As many of you are aware, there are various funding streams that have been made available to support the response to COVID-19 pandemic. FEMA may provide PA funding to applicants for eligible work under 4480 that may also be eligible for funding under another federal agency's authorities. Potential public assistance applicants may have the flexibility to determine which source of funding to use for their cost. If an eligible applicant applies for public assistance funding and then determines it will instead seek funding from another federal agency, the applicant should notify FEMA as soon as possible, but no later than 30 days from the date decision to seek funding from another federal agency is made. Public assistance funding should not be considered a funding of last resort. PA funding should be considered concurrently with other federal agency programs and sources. For certain types of work that may be eligible for funding under another agency's authorities, FEMA, in coordination with other federal agencies, has determined that it will not provide reimbursement for such work through the Public Assistance Program. FEMA has determined that PA is not the appropriate source of funding for COVID-19 contact tracing, as there are more appropriate sources of funding. Please see FEMA's fact sheet on coordinating public assistance and other sources of federal funding at the link on this slide. And again, please note that this presentation, as well as the links that are embedded in it, will be provided on our website. We're already getting questions about, will the presentation slides be made available? Yes, they will be on DSH's website. So Molly has graciously taken time out of her day to answer any questions for FEMA Region 2. So should you have any questions, please type them into the Q&A box. Okay, Molly, we are monitoring the Q's and A's. So the first one that came in that I can see is, are these FEMA expenditures reportable on the entity's schedule of expenditures of federal award, FEFA?
I cannot answer that question. I don't know what a schedule of expenditures of federal awards is. Sorry.
Neither do I, Molly, but thank you.
Okay.
So we will circle back with you, Julie, on that to see if we can provide assistance. So the next question we have is, are air purification device purchases reimbursable by FEMA?
That's a loaded question. We have, again, there was mention of 3 different time periods where we are evaluating eligibility a little differently. So after September 15th of 2020, our eligibility criteria for work performed in response to the COVID event was restricted. And even with the opening and operating policy, it's also restrictive as to what we can fund. So in those second 2 periods, September 15th to January 20th, and then January 21st and on, there's no discussion of air purification. So we would not be able to fund any work associated with that. Prior to September 15th, we are evaluating work based on the specific scenario of every case, based on our general eligibility criteria for emergency work, and based on the need, the use of the facility. Was the facility open? Was it closed? Who's using the facility? And whether or not any item of work was truly needed and necessary to reduce an immediate threat. So we don't have anything in writing that addresses air purification prior to September 15th. So we would have to just look at that scenario. There is some CDC guidance on ventilation. We would probably, expect applicants to use that guidance to support work that they did. I can tell you that nothing comes to mind. I mean, there are some specific air filters that are recommended with certain ratings that can and have been known to be able to address airborne contaminants, or I can't think of the wording, but basically we would be looking to that type of guidance. I would, in general, we wouldn't be funding things like upgrading a facility's ventilation system, though.
Thank you, Molly. So the next question is, does reopening guidance apply to school districts?
Yes.
Excellent. A follow-up question to that is, all PPE, including cloth face coverings, are reimbursable expenses for faculty, staff, and students who are actively on campus?
Again, it depends. If we're talking about, okay, so assuming we're talking about opening and operating, FEMA at some point made a distinction between PPE and face covering. So PPE, your N95 masks and things like that are limited, at least in based on guidance. The need is limited to, first responders and medical personnel, and maybe a few other folks. But, face covering, certainly a school district or, operator of a facility could certainly make the argument that providing face coverings to their employees would be necessary to reduce an immediate threat and to have a safe operating environment. And, I can think of lots of other scenarios where provision of face coverings would be eligible, but it's really something that the applicant has to present to us what the applicant did to reduce an immediate threat. and we have to take each case and evaluate it. But there's no specific restrictions placed on the provision of face coverings or the provision of PPE. It's basically what's needed to reduce or eliminate an immediate threat while you're operating your facility, and is it in compliance with CDC or public health guidance?
Thank you, Molly. Are sheets of plexiglass that we purchased to make our temporary barriers reimbursable?
It depends on when, the way FEMA evaluates eligibility, we have to look at the actual work that's performed. When it comes to plexiglass barriers, it's about when the barriers were installed. And so we have to look at our different eligibility periods, those 3 different time periods. And depending on when the applicant installed those barriers and where they were installed and whether the facility was open, if it was open, was it partially open or was it fully open and operating? We would have to evaluate all of those things to determine whether it's eligible. If it's after January 21st, where the barriers were installed, then that's, again, as long, I'm talking in generalities here, right? So assuming these were needed, we would be able to reimburse those costs. If they were installed before January 21st of 2021, we would have to evaluate it based on the other criteria that we have.
Thank you, Molly. Another question we got in is, are signage and floor stickers used for social distancing, directional flow, and general COVID precautions eligible expenditures?
As far as after January 21st, if they were installed after January 21st, yes. If they were installed prior to January 21st of 2021, it depends. It depends on lots of different things, and we would need to know the specifics of each scenario to evaluate the eligibility.
Excellent. Thank you, Molly. In that same train of thought, removal of temporary barriers. Would removal of a temporary barrier be eligible under safe opening and operations policy if the original purchase of the temporary barrier was not eligible under the policy at the time it was purchased and put in place?
If it's all going to depend on when the work was performed, and that's a really hard question to answer right now, because we have an open incident period, we have an open-ended performance work deadlines. So we'll just have to wait and see when things start ending, and then be all about when those temporary barriers were removed, and as to whether we would be able to pay for them. But the fact that they were installed during a period where we couldn't reimburse the cost to install them, that wouldn't have any impact on the eligibility of removal because of the opening and operating policy.
Okay, thank you, Molly. Another question, is the expectation for eligible expenses from September 15th through January 21st that they would be reimbursed at 75%?
Well, 100% is retroactive, but we have, I don't know, Rihanna, if you want to take that question, because it's all, right now, we're holding the reimbursement because of FEMA state agreement issues.
Okay. As Molly said, so what happened January 21st, specific to the safe opening and operation work eligible for public assistance, going forward, it's 100% for all of the services that we talked about related to the pandemic. Prior to January 21st, if I'm not mistaken, Molly, that the 100% reimbursement goes retroactive to January 20th, 2020, provided people also meet the established requirements of equity that were outlined in that January 21st, 2021 presidential memo.
Right, and the theoretically, yes, the 100% is retroactive, but currently there's a FEMA state agreement that is being worked through between FEMA and New York State. And until that document is signed, FEMA won't be reimbursing the additional 25% for the other work.
Okay, and just for a status, I believe that is now with the region for signature. That was a recent development, Molly.
Oh, lovely.
Next question. Would we accept purchases dated prior to 2021, but goods received after January 21st? I think what, Susanna, you're asking is, if you purchase an item that is now eligible under the Safe Opening and Operation Work policy, but did not receive the goods until after January 2021, would that be eligible for reimbursement?
Yeah, as long as you use those items. It's all about when they're used. So even if you purchased, if you paid for it and you were waiting, maybe there was a back order or something, and you didn't actually receive the items until after January 21st, and you used them, then we would be able to reimburse the costs, considering, assuming you're talking about something that's otherwise eligible. If you're talking about face masks, for example, if they were ordered, in October of 2020, and you didn't receive them until February of 2021, and you distributed them, in February 2021, then yes, we would be able to reimburse them as long as they were needed to eliminate a threat. So it just depends on the applicant and the facility and all sorts of other things. But in general, yes. Long-winded. I have to qualify all of my answers because there's so many different boxes that have to be checked to allow us to fund things. So.
Understood. Thank you, Molly. We recognize that everything is a little more fluid than maybe what we're used to. Next question. If a school district purchased thermometers, barriers, masks, etc., prior to January 2021, but is still using them now, can these expenses be reimbursed? And I feel like that's the tail end of the last question, Molly. So to recap what you said is, so long as they were used in the time period of January 21, then yes, they can be reimbursed.
Yes, I would assume so. That was kind of, as long as it's something that has to be used, we'd probably be able to fund that. The one thing that gets complicated are the things that have to be installed, right? Like plexiglass and stickers and signs. Unfortunately, if those things were installed prior to January 21st, 2021, we may not be able to fund those. That's the kind of unfortunate aspect of these different timeframes. But if it's a thermometer that you started to use before January 21st and you're continuing to use it, I don't see why we couldn't fund that. So it's just, this is all new to all of us. So that's the first time I've received that particular question. It's always been about installation of signs and stickers and things before January 21st. So again, long-winded answer, I think we would be able to reimburse those costs.
Thank you, Molly. The next question is, are guidances that are listed here being as of January 1st, 2021, an extension of previous authorized uses, or only the items previously expressly mentioned here in this presentation? I think what the individual is asking is, after January 21, 2021, are these items that were listed in the slides around PPE, and temporary barriers, et cetera, they only start to be eligible starting January 21, 2021.
It depends on so many different things. It depends on who the applicant is, what the facility is, when the items were used. Again, we have a pretty restrictive policy that's in place for work performed between September 15th. Oh, that's a good one. September 15th and January 20th. Before September 15th, we have a little bit more room where we have to really look at the situation, the specific situation, and we may be able to fund things for work completed before September 15th that we would not be able to reimburse during the period of September 15th to January 20th. So it's very hard to say yes or no.
Another question, would electronic doors and automatic faucets be eligible for local governments to get PA reimbursement? And also the addition of windows and facilities to allow for proper ventilation?
For opening and operating, there's no mention of ventilation. So I would say no to ventilation, to windows and what you said about the doors and the faucets, again, we would have to look at things like, was it reasonable, right? So sometimes you would think, yeah, that would be great. An automatic door, no one has to touch the door. But maybe it's $50,000 to install this door. And someone may look at that and say, well, that's not really reasonable. When you have everybody wearing face masks and signs and stickers to social distance and telling everybody to wash their hands, and you have automatic dispensers of antibacterial gel everywhere. Someone could look at a large expenditure like, improving upon an actual facility, like changing out a door. And someone could determine that to be ineligible. I don't know. My initial thought is no, I don't think we would be funding, upgrading an actual facility by installing a bunch of, reimbursing the cost of installing automatic doors. But, I hesitate to just say no. Everything, there's a situation and specific cases that we would have to look at. But, I would, if you want to upgrade your facility, install a bunch of automatic doors, I would only do that if you're prepared to absorb the cost, because it doesn't seem to me like something automatically that FEMA would reimburse. A soap dispenser, that's a little bit more reasonable. And again, depending on the situation, we might be able to reimburse those costs under public assistance.
Molly. Another question is, does this funding apply to public school districts?
Yes.
Very good. Another one, are disbursement of FEMA funds subject to compliance with Title IX by the recipient?
I don't even, know what Title IX is, unfortunately.
Equity in sport?
Oh, everything is subject to equity requirements. Again, I'm gonna stay out of the equity conversation right now because I just wasn't prepared for that.
Okay.
We've got a lot of language and on equity. And I think, New York State has all the information that we have. So if you have specific questions about equity requirements, you should definitely work through New York State.
Okay. And just to give, not necessarily for you to answer, Molly, but just to give you some idea of what's coming through, if you haven't seen it, like we had one question about equity regarding, can you please review again the clause that states that subrecipients must focus on the use of FEMA funding on the highest risk communities and underserved populations? My organization is a college. Does this mean that we are unable to access FEMA funding because our primary focus is not the highest risk communities?
No, absolutely. Thank you for bringing that. That is not what that means at all. There are some very specific requirements with respect to equity relative to distributing and administering COVID-19 vaccinations. But other than that, and again, I'm going to have to be really careful here because this is just not, I wasn't prepared to talk about this much, and it's a difficult topic. The way that FEMA's looking at it is more from a state or territory-wide approach to addressing equity as a whole. So as long as that university isn't doing something that directly conflicts with the Civil Rights Act, as long as you're not discriminating, you may be asked questions about equity and how you might be handling equity while you're disinfecting your university. And you may think it's kind of a ridiculous question. And if you're asked those questions, you just answer, well, we are operating a university and we're disinfecting it. And I'm sorry I'm being silly, but I guess you have to be prepared to be asked questions about equity that might not make a lot of sense based on what you as an applicant are actually doing. Because we're just faced with this situation where we have to ask the questions. But in general, there are plenty of things that applicants are doing with respect to operating their own facilities that, some of these equity requirements aren't going to apply. And the only thing that's going to get you into or where you'll be at risk of potentially losing funding is if you're violating the Civil Rights Act.
Very good. Thank you, Molly.
Hopefully that answered that question.
It did. One on equity that I think is pretty much easy, doesn't get into the weeds, is unlike the vaccination sites and wraparound services for vaccination where there are very specific reporting requirements, at this time, are there any reporting requirements for the equitable response in Category B work?
Other than vaccination, distribution, and administration, no.
Thank you. Going back to plastic barriers, that seems to be very common with some of our individuals on the phone. We got a question about, are plastic barriers for students' desks in schools eligible for the third period starting January 21, 2021? Molly, you might be on.
Sorry, I was muted. If installed after January 21st, 2021, then yes.
Okay. And then someone wrote a follow-up to that. If the work is started before the third phase, i.e. temporary protective barriers, but work is not completed into the third phase regarding the installation of temporary barriers, can cost for the barriers be claimed under the third phase of the policy?
I would say definitely submit that request and we will evaluate it. I can't really say right now. There's definitely a
You cut out there, Molly.
Oh, there's a possibility that we would be able to fund that. I just can't answer that question definitively. So I would suggest that you go ahead and submit a request for funding for that.
Thank you. If an applicant is not a state, local, territory, or medical facility, are expenses for testing reimbursable if there's no issue with legal responsibility? And if so, are those parameters written somewhere?
There's the opening and operating policy says that testing is eligible. It has to be necessary. It has to be reasonable. So it would really depend on what the applicant is doing with respect to testing. But there's no specific restrictions other than our general eligibility criteria: necessary, reasonable, needed to reduce, eliminate an immediate threat, that sort of thing.
Another question we have is, what about providing face covering for students at a school district? Is that eligible for PA reimbursement?
Again, no restriction according to our policy. So as long as it's reasonable, then again, hard to answer hypotheticals. We'd need to see the situation, but in general, yes, we'd be able to fund face coverings to students.
Excellent. Another question in that same vein. As a school district, we have to install barriers before students enter the school. So that would have been before 9/15/2020 to protect the safety of staff and students. Would this be exception for installation prior to January 21st of 2021?
Unfortunately, according to the way policy is written, we have to look at when the work was done. I don't know what we would do if barriers were installed on January 19th, or January 15th. But then you start looking into back as far as 2020. I just can't answer that question in kind of a hypothetical framework. The by the book answer is we look at when the work was performed, and we look at our eligibility criteria that applies to when the work was performed. I understand how that doesn't really jive with the idea of installing plexiglass barriers prior to having children in the school. And if it was done prior to January 21st, we just, again, can't answer it. We'd have to look at the situation, the specific situation.
Thank you, Molly. And on the vein of school districts, a question came in that now that 12 to 15-year-olds are authorized for the Pfizer vaccine, would school districts be eligible to be reimbursed for performing vaccination work on campus?
Vaccinations were not included in the opening and operating policy. So we would have to look for vaccination eligibility. We have to look to our medical care policy, which is specific to medical facilities, whether they be existing medical facilities or temporary vaccination sites that are set up. So unless a state or local government set up a temporary vaccination site in that school, I'm not sure we'd be able to, I don't think we'd be able to fund a school district specifically vaccinating its students, no. it would have to be, students would have to go to a vaccination site or a medical care facility to get vaccinated.
Thank you, Molly. Next question. Can the cost of preparing and delivering meals for public school district students be considered emergency feeding under this policy?
Well, it wouldn't under the operating and the opening and operating policy. We do have a food distribution policy that talks about state and local government setting up sites for food distribution, but not if a school is closed and providing lunches to students who are not attending school, then that very specific example, the answer would be no.
Thank you. Another question from the school district. We had to do COVID testing for athletes per our county health department. Would this cost be reimbursable?
If it is after, if the testing is performed after January 21st, and the testing is being done by the school district, then yes, we reimburse that.
Thank you, Molly. A question came through. Does this policy apply to sheriff's departments in addition to school districts?
It applies to all eligible applicants and all eligible facilities. So yes.
Thank you, Molly. Another question along the vein of testing, is diagnostic COVID-19 testing eligible between January 21, 2021 and 9/30/2021 for applicants that are not an SLTT or medical facility, such as schools, nursing homes, or other non-medical PNPs, assuming the frequency of testing is reasonable and the applicant can articulate the necessity for the testing?
Yes. Also, if, well, I guess that wouldn't apply. I was going to say something about insurance, but never mind. Yes, it's not restricted to medical care facilities after January 21st.
And then a follow-up to that is, what are the limitations regarding these tests? Can they test all students and faculty at schools and residents and staff at other facilities, or are there limits?
There's no specific limit in policy, but we look at everything with, the idea that everything has to be reasonable and necessary. And so again, hard to answer that question.
Thank you, Molly. Diagnostic COVID-19 testing. Assuming the tests were necessary and reasonable, would rapid antigen tests done by a college/university on site using nursing instruction staff and nursing students be eligible?
I cannot think of a reason why it would not, as long as it's necessary, reasonable, etc.
Thank you, Molly. What frequency of surveillance testing is eligible for reimbursement? We currently test faculty and staff weekly and students twice per week.
There's no restriction, no definition in policy. It would be, up to the applicant to support that the testing was reasonable and necessary. So there's no restriction other than reasonable and necessary and, in accordance with public health guidance.
Thank you. Will FEMA publish a list of all eligible Cat B work relative to reopening? For example, are air purifier systems, no-touch sanitation dispensers, and other such measures now eligible under reopening?
As far as I know, there's nothing in the works currently. We have the policy and but we do know that air purification was not included in that policy. So, it's only what's listed in the policy. but I'm not aware of any list.
Thank you. Going back to testing, are there any guidelines in reference to COVID testing for reopening? Can any PNP reopening their facilities test anyone entering their facilities, or do they have to exhibit symptoms?
Again, there's no restrictions. The applicant would have to show how testing someone walking into their facility is necessary to reduce an immediate threat. The only way I could imagine that would be the case is if the test results were, provided immediately. But I'm just speculating. It would be up to the applicant to show that the testing is reasonable and necessary and in accordance with public health guidance.
Molly, and we're getting a lot of questions regarding the slides from today. As stated previously, we will post those after the call within the next 24 to 48 hours. Similar question around testing. We performed COVID tests at our school district and had to pay our school physician to be added to his state license and insurance. Would this be covered?
It does not. Just based on that question, I don't think we would fund that, but without more specific information, I can't really answer.
Thanks,
If you're saying adding a physician to an insurance policy, is that? I'm sorry.
I think it sounds like that their school physician had to add the school as their site license and perhaps extend his insurance to cover that in order for him to perform COVID tests on campus. And I think the school district is asking if that extension, otherwise non-budgeted piece of the physician's cost that's now required because of the COVID testing needed to ensure safety, if that expansion would be covered.
Yeah, it sounds to me like it's an expense that the physician takes on. So that's why I'm saying no.
Okay.
If there are specific costs that the school district is taking on, we might be able to, but even then, that description, it sounds to me like we wouldn't be able to fund that regardless.
Okay. And I know you mentioned equity is sort of on a soft table, but individuals are asking, will there be further guidance regarding equity and how it applies to Cat B work outside of vaccination work? So are we awaiting any additional guidance there, Molly?
Not that I'm aware of, no.
Thank you. Another question, is all disinfecting eligible for reimbursement or only that is above and beyond what is normal to our daily cleaning regimen?
It's only above and beyond.
Excellent. Buckets of disinfecting wipes were placed in classrooms and common spaces so that students could wipe down the area they were using before beginning of each class. Is that an eligible expenditure?
I don't see why not. I would think we would be able to fund that based on the, subject to all the other things I've been saying.
Thank you. Someone asked, what are the specific criteria to make, I think they're referring to the chart that's up on the screen. What are the specific criteria making these purchases eligible? The slide states limited eligibility. So if I'm interpreting Colleen's question correctly, I think she's asking on September 15, 2020 through January 20th, 2020, those personal protective equipment, cleaning, disinfecting, screening, temporary physical barriers, all of that says very limited eligibility, and it appears that she's asking what they would need to do to make those eligible for their specific project.
Okay, so between September 15th and January 20th, the policy states that those types of things could be eligible if necessary and performed in conjunction with otherwise eligible emergency protective measures. Also in medical facilities, food distribution sites, non-congregate shelters, those types of things. Prior to that, it's really, it's about, was the facility open? Who's using the facility? Was the work truly necessary to reduce or eliminate an immediate threat?
Thank you, Molly. Where does the applicant explain the need on the portal? It just asks basic information. Do we have to reapply for the items after 9/15/2020? When does the portal accept additional items?
Well, talking about the portal is not something that I am, I'm not the one to answer that question. The portal,
not a problem. So,
yeah, not my thing, but I can tell you that generally, if we have any questions about, something submitted in the portal, if there's not enough information, we would submit a request for information back to the applicant.
Thank you. And then for the individual who submitted that question, should you already have a DAR assigned to you or representative from DISHES, please reach out to them directly and they can provide additional guidance. Molly, if a school was feeding all children in the community under 18 years of age, is the cost of salaries to prepare and serve the food covered or just the food?
I would say neither. The schools providing food, if they're talking about food when schools were closed, that's not something that we're covering under public assistance.
Are there any hotel costs eligible for reimbursement that needed to be used upon arrival of students before the test results could be attained and before they can move into a room with a roommate?
No.
Thank you. If schools and colleges are now eligible to conduct testing, which was previously only allowed for states and local territories, are schools and colleges still prohibited from conducting their previously restricted activities, such as non-congregate sheltering and food distribution?
Well, they're certainly not prohibited from doing that, but FEMA can't cover the cost of those under public assistance.
Thank you, Molly. As part of the New York State Governor's effort to vaccinate college students, New York State DOH has entered into an MOU agreement with colleges to perform vaccination administration using existing college nursing staff and nursing students associated with OT costs. Other costs include freezer purchases, PPE, and disinfection. Are such costs eligible for reimbursement under the current policy?
Yeah, questions like that I'm going to hold off on answering. It's getting a little bit
medical.
Yeah, a little bit more specific, but still hypothetical at the same time. So, a lot of questions like that, you just have to work through the folks that you're working with at the state and with FEMA, so that they can look at the specific case that you're referring to.
Thank you, Molly. And for those of you on the line, if you continue to put your questions in the Q&As, then we can ask them. We're almost caught up. When it is said that testing has to be reasonable, is this only after January 21 of 2021?
Well, prior to January 2020, everything has to be reasonable for FEMA to fund it. prior to January 2021, well, the period between September 15th, 2020 and January 20th, 2021, testing is only eligible if it's performed in accordance with the medical care policy.
Thank you. Trying to sift out some of those very specific medical ones per your request, Molly. Isolation and quarantine care. Are any costs associated with wraparound care for individuals that were in isolation or quarantine now eligible for reimbursement?
Outside of a non-congregate sheltering situation, no.
Thank you, Molly. Just checking quickly to make sure that we have captured all of the questions. There is one question around, can we get a copy of the policy? The policy is currently on the DISH's website that was shared earlier with everyone here. You could also Google New York State DISH's recovery, and it will bring you not only to the policy on safe opening and operation work eligible for PA assistance, but the other interim policies that we've been referring to, including the medical that was recently released, as well as the commonly referred to September 2020 policy. So one more question came in, Molly. In reality, most schools in New York State reopened in September and incurred the costs that are now allowed starting in January 2021 back in September. Is there any discussion about revisiting the policy to apply current policy to those specific costs?
I imagine there is a lot of discussion about that somewhere, but I guess as far as I know, this is the policy and it's not changing.
Understood. Another question came in. We're a small private school and have increased a salary to cover the extra time spent screening, temperature checks, and testing. Can this salary unbudgeted increase be reimbursed?
If the employee whose salary has increased is a full-time employee, then, well, I would think regardless, the way the question is framed, I think I could just say no. If that employee is, their salary increases, so I imagine their overtime, if they're working overtime, maybe their overtime rate increased. Unless as a salaried employee, maybe the individual doesn't get funded overtime, and maybe that's why you're asking the question. So, sorry, I'm trying to work through it in my head.
No, I understand. It sounds like they had to hire someone just to do the screening in order to keep things running, and because it was an unbudgeted cost, I think they're asking because the specific duties associated with this increased personnel was, for safety of the students in the school, if that increase in a salaried person could be reimbursed.
Yeah, we don't fund labor costs for permanent full-time employees of an applicant other than overtime costs. So even if it's a new hire, if the applicant brings on temporary employees, then that's a different scenario. But the way the question is phrased, it sounds like a new employee of the applicant. So we would only be able to fund overtime.
Okay, thank you. However, if this was a temporary staff person for temperature checks and testing, that could possibly be reimbursed?
Yes, the time spent doing eligible emergency work, yes.
Thank you. Which leads to another question. It says, it's pretty general. Are personnel and overtime costs eligible?
We haven't changed our eligibility criteria for labor costs. So it all depends on the type of employee and the work that's being performed.
Thank you. So I have another question regarding timeframes. Regardless of the time frame, is not all work deemed necessary and reasonable by the applicant to reduce contamination and the threat of COVID to individuals with developmental disabilities and to, as a protection of their health and safety eligible? So it sounds like the individual is asking if the work that was put in place even prior to January 21, 2021, eligible so long as it can be linked to necessary and reasonableness.
Yeah, it depends, because during the time period of September 15th to January 20th, the work that FEMA was funding under public assistance was very limited. It depends on, you know, for the most part, most applicants performing disinfection type activities, that work would not be eligible between September 15th and January 20th of 2024, with limited exception as described in that policy. But for most applicants were affected by that policy because it was very limited to tying cleaning and disinfecting with the performance of otherwise eligible emergency protective measures.
Thank you, Molly. Just to acknowledge, we've gotten several individuals writing in stating that they are a small private school and this is their first time listening to a DISH's WebEx and they would like more information. Again, if you go to the New York State Homeland Security and Emergency Services, type in active disasters. There is a email there that's generic and we will be more than happy to get back to you. We will try to pull your contact information from the Q&A, but for those of you that this is the first time you joined us, welcome. And we look forward to subsequent conversations with you. Just make sure that you have all the information you need to determine whether or not you would be an appropriate applicant for public assistance funding. And Stephanie was kind enough to provide a direct link to everyone to the DISH's website. So we got another one came in. Our county is providing a % surge charge payment to our bus company to purchase PPE and cleaning of buses. Is this eligible?
It does not sound like it is. No.
Okay, thank you. Another question. Deputies and correction officers who were out on COVID whereby overtime costs were created to cover shifts. Would this be an eligible expense?
I'm going to leave that to the folks that are working on the operation. That's another very
technical,
case specific
okay.
question.
So for the individual who wrote that in, if you are already an applicant for 4480 COVID-19, please reach out to your DAR to get specifics on that, so that way we can respond to those very specific conditions. And Molly, I'm pausing because I'm waiting to see if anything else pops.
Okay.
Okay, I'm not seeing anything. So Molly, I just want to thank you very much for partnering, continue the partnership with New York State as we continue to navigate PA funding for COVID-19. We appreciate your time. We recognize that you are very busy. So to continue to partner with us on these COVID-19 specific policies is greatly appreciated. For everyone on the line, thank you for your time. We recognize that people are double, triple booked, and that PA can be, under a normal day, a little difficult, and now can be even more challenging as the rules change. And with that being said, I just got one more question, Molly, apologies. face coverings for students, was that eligible in period one being defined as January 20th of 2020 through September 14th of 2020?
We don't have many restrictions to what we can fund during that time period. It all depends on whether the facility was open, when the face coverings were distributed, again, reasonable, necessary, all of those things. So there are scenarios where we have been funding those things, but the issue is if you've already requested the funding may have been denied during that time period because there was a lot of confusion with respect to eligibility during that time period. If that's the case, I mean, gosh, I think we've received like 40 appeals from school districts for costs denied during that time period. So we're looking very closely at those appeals, and there may be things that we're going to approve under appeal that were denied during that time period, just because there, like I said, there was a lot of confusion and we didn't have much specific guidance to go off of. So in some situations, yes, we are funding face coverings during that time period for schools, providing them to students.
Thank you, Molly. And another one's come in. For schools, are expenses such as Purell stations and touchless thermometers covered during the ongoing period?
Touchless for the operating and for opening and operating, yes.
Thank you. Okay, and we like to end on a yes. So again, Molly, I thank you for your partnership as we continue to navigate the COVID-19 PA assistance eligible work, and all of you on the line, thank you and have a happy Tuesday. Goodbye.